Hi, my name is Alana Tolliver, and I'm going to be talking about the No Taxpayer Funding for Abortion and Abortion Insurance Full Disclosure Act of 2014. This act is also known as H.R. 3 of the 112th Congress. A little history on this act. Anti-abortion protesters and Republicans felt it was unfair to use taxpayer money to fund abortions. They argued that not everyone supports abortions and therefore not everyone should be forced to pay for them. Previous legislation allowed for taxpayer-funded abortions through the use of Medicaid and other government-run programs. And this new legislation will permit taxpayer-funded abortions. However, there will be a lot of restrictions with this. For example, rape victims can be covered under this. Victims of incest or those mothers with life-threatening pregnancies can have government-funded abortions. However, with all of these issues, it must be certified by a physician and documented before it will be covered. The status of the legislation: it was introduced May 14th of 2013. It was also referred to the committee that same day. It was reported by the House Committee January of 2014. It passed the House vote just this year, January 28th, with a vote of 228 to 188, with the majority of the supporters being Republicans. It was a 221 Republican vote and 6 Democrats to support this legislation. As for what's next, the bill will go to the Senate vote. If it's passed at that time, it will be signed into law by the President. The financial implications are a huge part of this bill. There's going to be higher out-of-pocket costs for women wanting an abortion that don't fit the criteria that allow for funded abortions under this legislation. Previously used funds can be distributed elsewhere. While there's nothing set in stone in this legislation saying where the extra funds will go, there's been discussions of giving the funds to state governments. Healthcare plans that currently include abortions on their list of covered items will no longer be covered under most insurances, especially if those insurances are funded by the government or states, such as Medicaid. Big ethical considerations when discussing abortion: pro-choice versus anti-abortion. Is it right to limit funding because groups feel abortions are not ethical or don't agree with them? And it seems like this is really being broken down into those two categories, and almost as though the Republicans are versus the Democrats. Democrats are saying that the Republicans are using this legislation to try to define what rape is. The inability to access care is going to increase significantly. Women may not be able to afford an abortion that does not meet the criteria for funding. The government-run facilities will not offer abortions, and physicians that are employed by the government cannot perform these abortions. There are large fines for the government-run facilities and the physicians who do not follow the rules of this new legislation. The quality of care may suffer overall, as abortion clinics may not be able to collect the full amount from their clients for the procedures, and facilities will not be able to afford the most up-to-date equipment if that occurs. They will be getting no funding to help in any manner, but they will still have government mandates in place as far as how to do the procedure and maintaining sterility, that kind of stuff. Quality of life for some women may suffer. Women wanting an abortion for a reason that is not excluded on this bill may have to carry the child to full term, which could result in lesser quality of life. People that are opposing this bill say it takes away the right to choose on behalf of the mother, and that it's overall decreasing the amount of autonomy by some of the patients. Legal considerations. Is it legal to stop funding for medical treatment? It's a big issue with this legislation right now. This legislation also does not apply to minors. And the biggest consideration in this legislation is the controversy over the definition of rape, which excludes some abortions. It seems that they're discussing forcible rape versus other forms of rape, such as being drugged, and saying that's not covered. So there's a big legal discrepancy on the definition of rape. If this bill does pass the Senate and then gets signed by the President, there will be a loss of government finances to support these abortions. Abortions meeting specific criteria can still be funded, and that was the rape, incest, or life-threatening injuries. There will be less physicians and facilities offering this procedure, which reduces availability of care for many women. And insurance companies will stop funding abortions as long as those abortions do not meet the criteria. And this has to be disclosed to people when they sign up for the health care plan. And here's a list of references